Chief Investigator Ron Regan was invited to the White House just last week when the president unveiled his plan to curb the crisis.
Ron's here tonight, and Ron, you found that these pill mill doctors, they have these serious disciplinary records, and yet they stay in business.
Well, most of us would never keep our jobs if engaged in the type of behavior we uncovered. But we found doctors across Ohio who kept theirs, then went on to profit from pill mills.
Yes.
No.
Yes.
No.
No. Yes.
No.
With a single vote,
Abstain.
Abstain.
Yes.
yes, doctors in Ohio can keep or lose their license.
I feel like if they would have shut him down earlier, my son would still be here.
They're regulated by the state medical board. Its mission, protect your health and safety. Frank Yunker headed up the DEA's drug diversion program in Southern Ohio.
Millions of dollars. This is big business.
Big business, and the medical board knew it.
Yeah, and it was frustrating because, something probably should have been done, obviously a long time before that.
By 2007, more than 2,000 Ohioans were dead. But we found, despite the surge in deaths, the medical board was slow to respond. Meanwhile, pill mill operators grew even more bold, setting up shop in the shadow of the medical board's Columbus headquarters.
He was my world, and they helped turn my world upside down.
And it's here where Jenny Dunn's 29-year-old son went every month for painkillers.
Oh, I'm heartbroken. Because I was afraid that I was going to lose him.
John Dunn Jr. died from an unintentional overdose in 2009. But we found his doctor was also well known to the medical board, a board that found Dr. Terry Dragish was a cocaine addict the year before Dunn died.
If somebody would have acted before they did, if somebody would have done something, my son would still be here.
Still, the board never revoked his license.
There's no words. There's no words. I mean, they're supposed to help save lives, not help take lives.
Instead, federal prosecutors say Dragish was able to spend 8 full years seeing 50 to 100 patients every day at this now closed pill mill, right under the nose of the medical board. Meanwhile, Dragish continued for years, only to voluntarily surrender his license in 2013, just before he was indicted.
I do. I think that they turn a blind eye. I don't think that they act quick enough. They're just too readily out there, the doctors.
Look, he had so many issues dating all the way back to 2008.
We reviewed 36 others charged with operating some of Ohio's largest pill mills.
That's a number of years before anything really happened.
Nearly 1/3 continued to practice for years.
A lot of probation.
Despite serious disciplinary histories.
I would say it's been my general impression from wherever I've been that medical boards are pretty much always reactive as being proactive.
In the last 7 years, the number of doctors who lost their license for improper prescribing has now more than doubled. So why was the state board, whose mission is to protect you, so slow to act in the early years, as hundreds of Ohioans continued to die year after year?
It's hard to say, Ron, I'm trying to duck and dodge. I can only tell you when I got on the board, we were definitely more attuned to the issues, not just in prescribing, but sexual boundaries issues, and we go down the line.
Robert Giacalone is president of the Ohio Medical Board.
Was that a failure of the board at that time?
Ron, I can't talk about that because I've only been on the board 5 years.
Why would those doctors keep their licenses?
Again, Ron, you're asking me a question I can't answer. If that was an individual today, he would not have his license.
But it allowed these doctors to stay in business.
Absolutely. Unfortunately, it did.
Ohio's opioid crisis is now the focus of the Justice Department's opioid initiative. So we went to Washington and showed our findings to Attorney General Jeff Sessions.
What is the lesson for medical boards across the country that regulate physicians?
They need to do better. It went on too long.
for physicians to prescribe this extraordinarily high number of pills and nobody know about it is hard to believe.
And despite that slow start, there is progress now in Ohio. There's now an 8-year low in prescription opioid deaths, and the number of prescriptions dropped dramatically in recent years. I'm Chief Investigator Ron Regan.